Hi, and welcome to NHS Oldham Talking Therapies induction. The purpose of this video is to give you a better understanding of our service so you can think about whether you'd like to access this. We know that accessing mental health support can be really difficult, and you may have lots of questions like, how do I get into treatment? What type of support is best for me? Today's video hopes to answer some of these questions. But there's also some information that we want to tell you before entering into the service that we think is really important for you to know. So we've included information on the important policies we have developed to keep you and others safe and our attendance policy. While we might not answer all of your questions in today's video, we hope to give you a better understanding of our service so you can see if we're the right service to support your needs. So today we'll be looking at who we are as a service, what we offer, thinking about is this the right service for me right now, what we ask for you as clients, and then looking at our confidentiality policy, and how you get started into therapy. So who are we? We are a talking therapy service made up of qualified clinicians that offer treatment for common, mild to moderate common mental health difficulties, and you can see examples of these below. We offer appointments usually from Monday to Friday between 8 and 5 p.m, and we support people who are aged 16 and over who live in or are registered with a GP in the Oldham area. We offer evidence-based treatments for individuals that have difficulties with low mood and anxiety, and the range of different treatment options depend on the difficulties or symptoms you're experiencing. These include, but are not limited to, the following treatment options: cognitive behavioural therapy, which looks at our thoughts, feelings and behaviours, understanding how these different symptoms interact, and learning tools and techniques to help cope with how we're feeling. We also offer counselling, both for individuals and for couples. This is aimed to process your situation, whether this is related to something that's happened in the past, how you're feeling, or something that's happening at the moment, like a change in your circumstances or a bereavement. Counselling is recommended for those experiencing mild to moderate low mood and depression. These options would be discussed in more detail in your appointment so that you and the practitioner completing the assessment could come to the best treatment decision. At NHS Talking Therapies, we offer different ways of accessing treatment, including computerized treatment, group treatment, online and in person, and individual therapy sessions, either face-to-face, video or on the telephone. We know that no two people are the same, and this means we all have different preferences for the way that is best for us to access treatment. Our computerized therapy platform is called SilverCloud, and this introduces modules based on cognitive behavioural therapy. This way of accessing treatment can be really beneficial for a number of reasons. Firstly, the platform can be helpful for anyone who struggles to commit to specific set times for appointments. As on the platform you don't have a live appointment, but you can log on whenever you want, and roughly every 2 weeks for about 12 weeks, a qualified clinician from our service would leave you a review to track your progress and answer any questions you may have on the platform. The benefits of this means that you can access this form of treatment immediately after an assessment and would not be placed on a waitlist for treatment. Here you can see roughly how the platform works. So you can leave messages to your supporter, you can access the tools section, and you can go through the different modules on the platform. As well as our online platform, we have groups, again online or in person. Thinking about groups can be really scary, but we know that experiencing symptoms of low mood and anxiety can feel really isolating. Our groups aim to introduce the tools and techniques that have been proven to be beneficial to improve how you're feeling. This does not come with the expectation that you need to share how you're feeling, but we'd always encourage people's contributions in the groups. Feeling like you're not the only one that is going through these experiences, in a space where you're all aiming to learn how to improve how you're feeling, can reduce this isolating feeling and help motivate you to put these tools into practice to help yourself. With most of these groups, there would be no waitlist and you'd be placed onto the next available group that we're running. Attendance to these groups requires a telephone assessment, and we'd need to be agreed in service before anyone would enter onto these groups. We also offer individual therapy sessions, either face-to-face, video or on the telephone.
Hello and welcome to this short introduction to employment support. My name is Adam and I'm one of the employment advisors within Talking Therapies. Over the next couple of slides, I'll be telling you a little more about who we are and some of the services we offer. In employment support, we offer a range of services all dependent on each individual's needs. This includes pre-work support and in-work support. We can help assist with finding work and vacancies. We can also support to help you stay in work or even help you make reasonable adjustments to aid you navigate a return to work. Even if you are unsure as to what you'd like to get into, you can spend a couple of sessions with an experienced employment advisor to help identify what is right for you and the necessary steps to get to that point. We also know not everyone is ready for work, so we can also support with finding job training and education options such as college and university, or ESOL and other courses. If you decide volunteering or work experience is something you'd like, we can help find the right opportunity for you. In addition, all our appointments are tailored to your preference. We offer the choice of face-to-face, telephone, email and text appointments, all lasting up to an hour, including interpreters if necessary. Appointments can either be weekly or fortnightly. Employment support is provided for up to 3 months. You can refer into employment support from the moment you refer to Oldham Talking Therapies up until your last session with your clinician. For example, if you are about to be discharged and you decide to sign up for employment support, you are still eligible to refer, and you have 3 months with your employment support after your discharge from therapy. Unfortunately, if you are not engaged with the Oldham Talking Therapies, you cannot access employment support. Some more specific examples of what we offer include giving you advice on how to talk about and explain mental health to employers, support with self-employment and business startup, completing or creating CVs and cover letters, and interview preparation. We also offer the option to be signposted to a local service catered to your needs. This can be if you are struggling with debt, benefits, housing or homelessness. We can make you aware of what services are available and help you get into contact with them. You can also choose to be signposted if we come to the end of the 3 months, or if one of the services we look at seems like a better fit for you to progress forward. So, if employment support is something you think would benefit you, please tell your therapist in your appointment or contact the office number on 0161 716 2777. Thank you very much for your time.
Thinking about accessing our support, you may be thinking whether we cover the support you need or whether now is the right time to be accessing support for you. These are really important questions to have in mind. We appreciate that often external factors may be having an impact upon your mental health, and although we don't provide direct support for the following, we're happy to point you in the direction of other services that do. For example, anger management, support with drugs and alcohol, advice on medication, social support like finances, housing, isolation, diagnoses, assessments for ADHD or autism, dialectical behavioural therapy, physical health advice. But here you can see some services that might be able to support you with your ongoing issues. Before starting treatment, it's really important to know that therapy is not always easy. We sometimes think of this with the analogy of that cupboard that you might have in your house, where you put all those things you need to deal with at a later date. Every time we budge past that cupboard, things might start to fall out and it might be a little bit of a mess. But in order to make the cupboard all organised, we probably need to get everything out and have a bigger mess before putting everything back in its right place. The same goes with therapy. Things might look a bit worse before getting to this end result. And to get to the end result, we have to put in hard work, including setting time aside and being committed to coming to our sessions, completing our out of session or in session work. With this in mind, it's important to ask yourself, is now the right time for therapy? And be kind to yourself and remember it's okay if it feels too much to commit to this right now. Timing is key. We might not be ready to engage right now with therapy, and if we rush into things when we aren't ready, this can be off-putting and can form unhelpful ideas such as therapy is not helpful ever. Well, it might just be that it's not helpful for you right now, where it could be at a later date. You are always welcome to make a re-referral at a later date when you're feeling ready to commit to therapy. It's important to prioritise what is best for you right now. thinking about things like, do I need practical support with something first? And thinking about, is treatment right for me? While therapy can be really beneficial, not everybody benefits from therapy, and sometimes practical changes and getting involved in things like enjoyable groups or activities in your community can be more effective. We're all different, and this is why we have different approaches to helping improve our mental health, and talking therapy is only one of those approaches. We know that therapy is a treatment that is only helpful when someone attends regularly, and missing appointments that means that therapy won't be effective. It's most beneficial when appointments are weekly or fortnightly, and this is why we want people to attend regularly. Therefore, it's really important to start therapy at a time when you can commit to attending weekly or fortnightly appointments, and have the time to complete tasks between appointments, because this is an important part of the work you'll be doing. We'll be talking more about attendance policy shortly. We will ask you to complete questionnaires before each appointment, either online on our portal or in a paper copy if needed. We don't diagnose with these questionnaires, but they're there to help us make treatment decisions and track the progress of your treatment. It's really common when people are feeling low and stressed or anxious to experience thoughts of not wanting to be here, wanting to harm ourselves in some way, or we might have concerns that are a risk to or from others. We're not a crisis service ourselves, so if you're currently concerned about keeping you or others safe, we would recommend calling 999 or going to A&E. We would develop a safety plan in your initial assessment and ask you to follow this and contacting others as needed. This plan would look at how to keep you safe and what keeps you safe. We also have Pennine Care's 24/7 mental health support line that you can contact for support. As just stated, attendance is really important to get the best out of therapy. We are a busy and active service, so we've had to develop a set of rules to ensure that everyone has an equal opportunity to access therapy. This rule is that if anyone misses 3 appointments with us by not attending or cancelling them, we would not offer any further appointments, and you would need to refer yourself back into the service to access therapy. We always advise that you complete a self-referral to us or ask a professional to refer you into the service when you feel ready and able to commit to therapy. If things change and you find you are missing appointments, it is more beneficial to stop therapy and re-refer back to us when you are able to commit to working with us. So it's really important that you do attend all your appointments and committed to working with the therapist, so that what we offer is to help you work towards recovery. Talking therapies are challenging, as said, and can be helpful, require people to work hard and make changes. This can be a bumpy road and leaving people feeling up and down after appointments. So it's important for anyone to feel ready for a talking therapy and have some support and stability in their life to help them alongside the work they're doing. We would expect you to attend all your sessions on time and in a private space where you can speak confidentially. If you do not attend your first appointment and do not cancel ahead of time, we'll assume that you no longer wish to be seen and we will not offer further appointments. If you miss any other appointment without telling us first, then you will need to contact us within 72 hours, 3 days, to confirm your next appointment or ask for a new one. If we have not heard from you within the 72 hours, then we will assume that you no longer want therapy and will not offer you any further appointments. If you either cancel or do not attend for 3 appointments across the course of therapy, you will not be offered any further appointments. You, of course, can refer yourself back in at a later date and a time that's easier for you to attend, which can be done on our online portal or by calling the office on 0161 716 2777. Missed appointments will also count towards the number of sessions in your therapy. It's really important that you understand this before starting into therapy. We've also developed some important rules on where information goes that you share with us, so that this information is shared with the right people to ensure you have the right care in place, and so we can make sure you and other people are safe. What you share with us remains confidential within the trust. This also involves updating your GP on any information that we need to share with them. However, there are limits to confidentiality that are really important for you to know if you are accessing our service. If a crime has been committed, we have a duty of care to you and the public to act upon this. Therefore, there are times where we have to share information with external authorities, like the police. This is when we have any concerns about anybody's safety. This includes times when a person shares information about any form of abuse, physical, emotional, sexual, including historical childhood sexual abuse. If you do share information about experiences like this, we have to discuss this with our safeguarding team, and they can request that we share it with other authorities. It is important that you know this so you can make a decision about what you share. We would always try and discuss this before sharing information with other services, and we'd always try and gain your consent to share information. But sometimes we'd have to share this without your consent due to the seriousness of what has been reported. We have a duty of care to protect the people we work with and the public, and safety is something we take seriously. If we do share information with the police, they would likely contact you about what you have disclosed to us and want to gather more information about this, and it is up to you if you want to talk to them about this. We understand that this can be difficult, and this is why we want to make sure that this is clear before you start working with us, and then you can decide what you're comfortable sharing with and understand our confidentiality. If we do have no concerns about yours or others' safety, then what you disclose to us remains confidential between our service and the GP. Here you can see the process of starting on therapy. So you'd either refer yourself or get a professional to refer you. You can do this on the online portal or by calling our office. And the professional referral would need to have your consent to do this. You would then book onto a telephone screening assessment using our choose and book system that we'd send out to you. Following this, you would attend the telephone screening assessment. This is with an individual that is a qualified practitioner, and it will last about 45 minutes to an hour. He will discuss the symptoms you're experiencing, your safety, and decide on a suitable treatment plan, either in the service or elsewhere if more suitable. Following this, you'd be assigned to a treatment option and either start on the computerized platform as soon as you're signed up, be assigned to a group, or be assigned to a wait list for individual therapy. We hope you found this beneficial. If you have any questions or important to address prior to your screening, please contact us on 0161 716 2777 and we'll try our best to answer these queries.